Good morning, everybody. I'm Chaplain Ryan Wilson with GHC Hospice, and I want to talk to you for just a moment about anticipatory grief. First, I want to just address what is grief. Grief is deep sorrow, especially caused by someone's death close to you. But grief can come from other losses as well. Job loss, divorce, pet loss, a role change with your loss, or just about any loss can be something that you might grieve over. The emptiness of what was there that is not there now. That's grief in general terms. So what is anticipatory grief? Anticipatory grief refers to a feeling of grief occurring before an impending loss. Typically, the impending loss is the death of someone close due to illness. Now, the grief usually begins at the initial point of diagnosis of that loved one. The grief is usually experienced by the patient, not for the loss of a death, but for the loss of what once was in their life. The initial point of diagnosis, it also, anticipatory grief affects those around the loved one, and they grieve before that loved one may pass. And it can be a grief over a loss of mobility, a loss of interests, a loss of ability to do certain things, or not being able to do certain things. So whether it's anticipatory grief or whether you've lost a loved one and you're grieving, some of the symptoms will be the same. Everybody will grieve, has grieved, or is grieving now. So let me just say, grief is normal. Both after loss grief and anticipatory grief are normal responses to a loss. They share many of the same stages and feelings: anger, sadness, shock, acceptance, bargaining, kind of the what ifs and if onlys of your life. All grief, including anticipatory grief, is a process to work through. All people grieve differently while experiencing some of the same stages. So I would say this to you, if you're experiencing anticipatory grief or just grief in general: allow yourself the grace to grieve. In other words, allow yourself to grieve how you might need to grieve, and allow those around you the grace to grieve on their terms as well. Allow even the patient the grace to experience their own anticipatory grief. What they're thinking, what they're feeling, allow them to just process this. Take your grief one day at a time. You will get through it. You will live a new normal. Some days will be tougher than others. Some days will be easier than others. Rest, read, review, reconcile, relive pleasant memories, reach out for help. If you're a patient, grief is normal to what you are experiencing. And if you are a loved one experiencing anticipatory grief over your loved one's diagnosis, reach out for help. You may be a medical caregiver of some kind. Reach out, because you may grieve for your patients and for your patients' families as well. Part of the problem of grief is wanting life to be like it was before. When you've been hit with a diagnosis or a loss, you may not experience life as it was before, but as the grief stages are processed, you will live a new normal, you will get through it, and you will become stronger on the other side of it. So just allow yourself those moments to be able to experience your grief and get through it. Thank you.